Hello, this is Darren from Danger by Degrees. Let me ask you a question. When you think of Africa and disease, do you think they would be leading the world in a COVID response when the developing world is hurting so bad? The answer is Africa is showing the world how to manage and beat COVID-19, while America, Brazil, India, Russia, Italy, many of the most developed countries in the world are drowning in COVID infections, and you see this on the news cycle constantly. You never really hear about Africa at all. Africa is not even on the news cycle. Who's to say what? Why is that? We don't know. But yet, the only real countries in Africa that are probably really hurting are South Africa, probably Nigeria, and maybe Egypt. Yet the rest of Africa seems to be showing how to stop an infectious disease from getting root and taking off in the community. So the reason is that many of the countries of Africa still remember and have in place previous facilities and institutions in place to deal with public health emergencies. All we have to do is bring up Ebola, and a country like, say, Sierra Leone or Ghana has the skills in place and facilities to move a disease response plan into action. The countries of Africa showing everyone the ways to deal with this problem started early with testing, and more testing. Lock down the borders, have the facilities in place to treat people suffering from, say, pneumonia or COVID exposure, and have safe places for people to quarantine themselves when their symptoms are not requiring, say, exceptional health care, and where they could, say, get regular stable food supplies, and generally speaking, be able to be safe and not a burden on anyone. So when you look at America, population centers are now there are so many people, and the infections have spread so far. The control methods that you would consider at the first level, such as contact tracing, quarantines, and so on, are basically just no longer even effective anymore, because the disease is now, or the virus, sorry, is now so spread that disease control matters now, short of a full-scale lockdown and a quarantine of metro areas, say like all of New York or say Dallas. Now, when you look at what's going on with Africa, the spread was handled as quickly as possible, and the need for serious, say, issues such as lockdowns never came up, because they were able to identify people early, they were able to contact trace the people that were exposed from them, and they were able to get those who needed treatment right away. Those who were under suspicion of being infected, they got into quarantine quickly, and through contact tracing, they were able to find people who could have been exposed and were tested. When you look at it, Africa literally showed how, with proper warning and with proper advance notice, these countries were able to stop this disease from landing and basically taking root. Another example that you might want to look at is Vietnam and some of the other Asian countries that, while they are not, say, on the level of America or South Korea or Japan, but Vietnam had in place ready to effectively treat anybody who was infected, have a quarantine system in place so that, again, people could be placed somewhere safe and sound, where they could be knowing that they would get any medications for, say, like minor illnesses, but would still get regular food, and they wouldn't be in an insecure situation. And when you look at, say, further Africa and, say, Vietnam, there's another element that really sparks to show you how they're able to take care of this problem from the start. They communicated quite clearly what was going on. The government wasn't trying to play down things. They were showing what was going on. They were able to get PPE where they needed. They concentrated on focusing on where the infections were starting and where they were popping up. And they effectively were proactive, and they communicated with the people. They were not acting in a dismissive or alarmist way. They spoke the truth, and they walked and modeled a type of behavior that also helped promote good social controls, such as social distancing, wearing masks, washing your hands, and so on. And as you can see, it's like when you look at how pitiful a lot of the reactions in a lot of the Western countries, who at the start kind of were caught unaware, but once the disease took root, were able to get a response plan in place. You look at Vietnam, you look at, say, Cambodia, you look at these African countries, and you see how they got in early, got the program in place, got the ball rolling on the ground, and they were successful in such limited numbers of infections and such low death rates compared to countries like Italy or America or even India or Brazil. Either way, there is many successes that we can learn from in Africa, and some of the other nations in Asia that should be applauded as well. Normal reactions when we look at, oh, Africa, oh, they're always full of disease. No, actually, Africa is showing us how we should be tackling these diseases and stop them from taking place in the first instance. Anyway, this is Darren, and this is another Danger by Degrees episode in the ongoing COVID-19 saga. There's many more coming, and trust me, every time I feel that, or we feel here at Danger by Degrees that we have done these issues to death, there's always more coming. So, if you like this video, share the video and comment. And if you really want to help out, subscribe and help this channel grow. Let's spread the message. Let's make Danger by Degrees viral in a good way, not viral in a bad way like COVID-19.